Hello everyone, it's Erudite
and 065
from Post Jungle.
Today we'll be discussing malaria. The origin of the word malaria is Italian, so it can be broken down into mal, meaning bad, and aria, meaning ear, because it is believed that people who got malaria then were seen near swamps. Malaria is a preventable and curable infection which is transmitted by the female Anopheles mosquito. About half of the world's population is at risk of malaria infection, and most of these people are in the tropical and the subtropical regions. About 200 million cases are seen per year, and about 400,000 deaths due to malaria are seen per year. The people at risk of malaria infection include children less than 5 years old, pregnant women, travelers to endemic areas, and immunocompromised individuals such as people living with HIV/AIDS. Malaria infection is caused by Plasmodium species. 5 species of Plasmodium are known to cause malaria in humans, and these include Plasmodium falciparum, which is the deadliest or the most lethal, Plasmodium vivax, which has the widest distribution, Plasmodium ovale, which is common in West Africa, Plasmodium malariae, which has the rarest distribution, and Plasmodium knowlesi, which is found in humans and other primates. Plasmodium species are transmitted to humans by the bites of female Anopheles mosquito when they feed on human blood in order to aid in development of their eggs. Sporozoites are deposited into the human circulation after being bitten by infected female Anopheles mosquito. These sporozoites enter the liver and undergo a sexual reproductive cycle to become merozoites, which leaves the liver. And this stage is known as the primary exoerythrocytic cycle because it is occurring outside of the red blood cell. Merozoites enter the red blood cell, and this is known as the erythrocytic phase to form schizons. Rupture of these infected red blood cells produces merozoites from the schizons. Some of these merozoites undergo sexual differentiation to form gametocytes, and these gametocytes are taken up by mosquitoes. These gametocytes undergo sexual reproduction in the mosquito to form zygotes, then to ookinete, then to oocysts, then form sporozoites, which migrate into the salivary gland of the mosquito, which can subsequently be deposited during the next blood meal into the human circulation. Some of the Plasmodium vivax and Plasmodium ovale merozoites, which leaves the liver, do not infect red blood cells, but rather they reinfect the liver and they stay in the liver dormant for years. They are known as hypnozoites, and these hypnozoites make it difficult to eradicate completely this Plasmodium species unless we use drugs that target these hypnozoites. These hypnozoites can remain in the liver for months or even years.
Pathology. Infected red blood cells are prone to hemolysis. This hemolysis would lead to release of toxins that would trigger or cause fever. Infected red blood cells express certain receptors that make them adhere to walls of the endothelium. Plasmodium falciparum infects red blood cells of all ages. Plasmodium vivax and ovale infect just the reticulocytes, while Plasmodium malariae infects old red blood cells. Red blood cells with hemoglobin S lack Duffy antigens. This is responsible for their characteristic immunity against Plasmodium vivax. In thalassemia and glucose-6-phosphorydehydrogenase deficiency, the red blood cells are prone to oxidative stress. Thus, parasitized red blood cells are quickly removed from the circulation. This confers some sort of immunity to patients with these conditions. Clinical features of uncomplicated malaria include fever, chills and rigors, malaise, anorexia, joint pain. So the clinical features of complicated malaria, a severe form of malaria, include coma, convulsions, hypoglycemia, severe anemia, hemoglobinuria, acute pulmonary edema, acute renal failure, metabolic acidosis, shock, and cerebral malaria. Investigations needed include thick and thin blood film. The thick blood film is used to determine the number or density of the parasitized red blood cells, while the thin blood film is used to speciate the organism. Quantitative Buffy coats may also be used. Polymerase chain reaction. A rapid diagnostic test are also done. Enzyme immunoassay. Treatment. Treatment of malaria is dependent on the severity of the illness. Uncomplicated malaria can be treated with chloroquine or sulfadoxine-pyrimethamine, also called Fansidar. Fansidar is currently being used as a prophylactic drug. However, the usage of these drugs has decreased owing to resistance developed in the course of using these drugs by the parasite. This has led to the new use of artemisinin-based combination therapy, ACT. ACT is recommended for treatment of malaria due to Plasmodium falciparum. Fast-acting artemisinin-based compounds are combined with a drug from a different class. Companion drugs include lumefantrine, mefloquine, amodiaquine, sulfadoxine pyrimethamine, piperaquine, and clopidogrel dapsone. Artemisinin derivatives include dihydroartemisinin, artesunate, and artemida. So these drugs can be combined in any of the following formats. For example, you can have a combination of artemether and lumefantrine. You can also have artesunate and amodiaquine. And then, importantly, one should not forget to treat the complication that may arise with malaria. So complications like shock can be treated with IV fluids. Severe anemia can be treated with blood transfusion where needed. Hypoglycemia can be treated with parenteral glucose administration. Lastly, vaccines are currently being developed in an attempt to eradicate and prevent malaria. These vaccines are currently undergoing clinical trials. For more interesting videos, don't forget to like this video and subscribe to our channel, Push Jungle. Thank you.
And we push it.